some doctors are going to be offended no matter what. Here's a story. Hello, everyone. I want to talk to you about making requests to doctors. It's one of the reasons I wouldn't want to be a nurse. There's a joke. How many nurses does it take to change a light bulb? None. They aren't allowed to. They can determine the health of the bulb, record its health in the charts, and order a new bulb, but the doctor has to change it. Basically, nurses don't have a lot of authority compared to a doctor, and nurses even have to be careful how they make suggestions to doctors, if I understand this right, is to not step on their toes. And I think that a good doctor knows when they have a very experienced good nurse, and hopefully knows to ask them sometimes, what do you think? What are you observing? If the nurse has, the experience and has been around the patient enough to maybe have that extra information. But yeah, it can be tricky. I think. That said, I wanted to talk to you about sometimes we have to confront the doctors to advocate for Raylan, which I think is even more tricky than a nurse coming to a doctor and trying to point out some extra information they might have overlooked. But yeah, it's just something we have to do. And I've tried really hard to learn the most respectful way to do it when I'm questioning a doctor, and I think I've gotten better at it. Some doctors are going to be offended no matter what if you speak up, but I also think it's important. So I wanted to give you an example of that and how I'm doing it as a parent. And yeah, I think it's even easier to offend a doctor if you're a parent than a medical professional speaking up. But I also think it's more important to speak up if you're a parent, because I don't know how to operate on my child better than anyone else, but I know my child better than anyone else. And I'm probably more familiar with her medical history than anyone else, including doctors that have access to her chart and understand the words a lot more than me. So all that said, here's a story of a conversation we're having right now with doctors. Raylan has a bony surgery coming up October 26th to remove her femoral heads. This is surgery to help reduce pain and to make her care easier, but it's also a very complicated surgery and a very painful surgery. So now Raylan's history, she's gotten infections from 2 previous bony surgeries. Those infections resulted in 4 other surgeries and 2 times coming home with PICC lines and long courses of antibiotics. So it's really, surgical site infections are not pretty. One of the things I know they do to decrease surgical site infections is when there's a bony operating procedure happening, they don't do other procedures at the same time. Like, for example, they would never clean a patient's teeth under sedation the same day they were going to do a bony surgery. So she has this vaginal abnormality going on that we went and saw the gynecologist for a couple weeks ago. They said, well, we'll do an internal exam maybe when she goes under sedation October 26th. And I said, well, that's for a bony surgery and she's high risk for infection. I don't know if they'll want something done at the same time. Is this something that's painful, or is this something that just makes patients nervous and maybe slightly uncomfortable? And she said, more just nervous and slightly uncomfortable. It shouldn't be painful. I said, well, if you don't mind, let's do it right now. I said, we accidentally get cath tubes into Raylan's vagina because we miss her urethra frequently. It doesn't upset Raylan. It doesn't hurt Raylan. Let's just try to get this done now and get some answers now and avoid having extra people in the surgery suite during her operation. So they agreed. They got some valuable information from that very quick exam. It didn't bother Raylan one bit. They just use, like, I don't know what it's called, but the things that look like kind of big toothpicks. I think they use them like to get pap smears. I don't know. They just used one of those. It didn't hurt Raylan. It wasn't a big deal. And they got some valuable information from that. Then they said we need to either do an MRI or a CT scan next. They want to do an MRI, but she has lots of metal in her back, so we don't think that's an option. Like, we'll get back to you about which one we can do, if we can do the MRI. It'd been over a week. They haven't got back to us. We're like looking at this time crunch because surgery's coming up. So I messaged them yesterday. I said, hey, what's going on? Does she need a CT scan or an MRI? Can we figure that out and get it scheduled? Now, the way I just said that to you is not how I said it to them. Let me look up what I said to them, because again, you have to be very careful how you word things to doctors' offices, that you're not stepping on toes or sound like you're telling them what to do. Let's see. This is what I sent them. I just wanted to follow up that we have not heard back if Raylan should get a CT scan or MRI yet. She has surgery coming up for her hips that will have her in an A-frame cast for maybe 6 weeks, plus a lot of pain issues. If her gynecological issues could be addressed before that surgery, it would be ideal. She is nonverbal and would not be able to tell us if pain was from surgery or her gynecological problems. Because one of the things they were concerned about was, is she hurting from this issue they found? And she's not now, but I think it doesn't mean that she couldn't start having pain from it. So I just gave them information. I mean, I let them know we haven't heard back, and just gave them some reminders about when she has surgery coming up, and then some information they might not have known, like the surgery includes her being in an A-frame cast for 6 weeks. Remember, Raylan's a nonverbal patient that has trouble expressing pain. That doctor's seen her one time for 15 minutes. So it was more, instead of saying, you don't know what you're doing, why aren't we getting this taken care of? Just like some information on why it was urgent so they could kind of decide. So I did that, and the answer I got back was, thank you for the follow-up. I've been in contact with a number of Raylan's providers. We are still working on the imaging issue. I do not have a definitive answer yet on what the best route for that is. I will let you know as soon as I do. And then her next thing was, however, I did get permission from orthopedics to complete an exam and vaginoscopy at the time of her upcoming procedure with them. I have a virtual conference that day, but can participate from here on campus to make myself available. We are working out the details, and my administrative assistant, Brenda, should contact you to discuss that. This is why I asked, can we just do this procedure in the exam room? And so they're back to doing an exam during this bony surgery. I looked up the camera for vaginoscopy. I looked up the procedures for that before getting back with them. It's a camera that's thinner than a pencil that they will put in her. It's not supposed to damage any tissue. It's supposed to be a very gentle thing. They do usually sedate little girls to do this because it's kind of traumatic, but it's not going to hurt necessarily. And so again, this is a little girl that's had major complications from surgery infections. We've gone home with PICC lines. We've gone on long-term antibiotics, which lead to increased seizures and just aren't fun to be on. She's needed 4 extra surgeries in her life trying to deal with surgical site infections. That's like one of our biggest concerns. She needs another surgery for pain management. It's a surgery where a surgical site infection maybe is higher. How do we, what all can we do to prevent surgical site infections? Anything we can do, we will do, we want to do. That includes not opening the operating OR doors over and over, letting people in and out, not adding more procedures than are necessary, not having her under sedation longer than necessary. So all those things. Now, I don't want it done unless maybe I'm wrong. Maybe she really needs to be sedated. Maybe the benefit of getting it done at the same time, even with increased risk of surgery site infection, outweighs having to sedate her twice. I'm not saying I'm right. I'm not saying I know this is the way it should be done, but there's some red lights going off in my head that I think doctors need to know about. So how do I politely tell them that? Here's what I told them, and you can tell me, is it good? Is it bad? Okay, here's what I wrote back to the doctor. I think it's too long. I think shorter is sweeter when talking with doctors, but I'm also trying to get all the information in as politely as possible and our wishes in without sounding like we're telling them what to do. It's challenging. And like I said, this relates to nursing because I feel like nurses sometimes see things in a patient. They know probably what the patient needs, but it's not their job to diagnose or to, suggest medication that's needed and stuff. So their job is to chart, to report, to tell the doctor symptoms, and to let the doctor diagnose and the doctor, suggest treatment plans. So I feel like this is a nursing skill Raylan is teaching me, is how to talk with doctors and give them information without telling them how to do their job. In some ways, it's easier for a parent to do. In some ways, it's way harder. I think it's important, though, or else I wouldn't be sending a doctor this. Okay, all that. Here's what I said. Raylan has had 4 additional surgeries needed due to infections that happened on/during previous bony surgeries. These infections also resulted in long courses of antibiotics and having to come home 2 different times with PICC lines. She is currently on a long course of antibiotics that is causing her increased seizures, but the risk of seizures outweighs the risk of infection returning. She is extremely high risk for hospital-acquired infections. I know that I have been told before that whenever possible, it is best not to do any other procedure in the operating room when a bony surgery is being done. I understand that ortho gave the okay. I don't know if infectious disease was consulted as well. Perhaps they also gave the okay. Personally, my husband and I would prefer if this get done. I always make mistakes. I sound so unprofessional. Personally, my husband and I would prefer get this done at a different time. Raylan did extremely well and did not seem nervous when an internal exam was done in your office. Is this something that needs sedation? Can she be given just some medicine to help her relax so it can be done in your office? We are at the hospital frequently and are happy to make an extra trip at any time you can squeeze Raylan in. If this whole thing can be taken care of before her surgery on the 26th, we would really be grateful. Even if the other teams think it is okay to do this procedure at the same time, as her parents, it would give us huge peace of mind if it could be done at a different time. We'll see what they say. That's something a nurse can't say. It'd give me a huge peace of mind, doctor, if you treat my patient with some this, or if you'd prescribe this. That's something a nurse can't say, but I feel like that's something as a parent I can say, hey, maybe it doesn't matter to you guys, but it'll help my nerves. Like, can you help me feel less nervous about it? I feel like that maybe can let doctors save some face to say, okay, we'll change procedure to make you happy. We don't think it matters, but if it makes you happy, it's not a big deal. We'll change procedure. So that's why I put that in there. I don't know what they'll say. And I could be wrong. Maybe it's no big deal to do this vaginal scopy at the same time. I think if there is any hesitancy about if it's okay, my note will cause them to reevaluate and not do it at the same time. I think if they were on the fence for should we do both these procedures at the same time or not, my letter will help them say, oh, mom cares, and go the other way. So yeah, kind of related to nursing, because I think nurses are put in this situation, not as much as on the line, it's not their child, but nurses sometimes know something that needs to be done. And it would be so easy, I think, if they could just go tell the doctor, hey, I see this, could you prescribe this real quick? I get the impression that's not how things are done. And like I said, nurses, correct me if I'm wrong, but I get the impression that nurses can't go, hey, my patient needs this, can you prescribe this? Like, hey, my patient's having this symptom, is there something that can be done about it? And then the doctor gets to suggest it. And I get why things are that way. Like, I also can imagine sometimes it's frustrating. And I don't have the experience of a nurse. I don't know. Maybe I'm asking for something that's not important. I think it might be though. So I spoke up and we'll see how it goes. Let me know what you think. Have you ever had to tell a doctor you disagreed with what they wanted to do or their treatment plan, or you wanted to suggest they try something else? And how did that go? Was the doctor accepting of what you wanted, or were they offended? Were they dismissive? Did you feel like they thought you were rude for asking? What's your experience been, either as a parent or as a nurse, if you've spoken up? Or if you're a doctor, I don't know if any doctors are looking at this, but if you're a doctor, what do you think if a parent comes to you with something like this? How would you respond to a parent like me making that request? What would you say? I would love to hear a doctor's opinion on that. I doubt any doctors are watching this, but if so, I'd love to hear what you think. Hey, just want to let you know I recorded that video a long time ago, but everything's fine now, and emailing the doctor and talking with them, that was definitely the right thing to do. They were able to do that procedure at a different time, which was great. So, and Raylan's doing great.